And now you see the gum has healed down to here. And what it has exposed is black calculus that was now visible in this root depression. So again, I'm just showing you over and over again how important understanding this anatomy is to you as hygienists with your instrumentation. It's going to house bacteria, it's going to house calculus, and you want to make sure you're not just smoothing it over.
So how long does it take for the gum to heal?
You know, generally it can, with good home care and all, I mean, healing is a long process, really. But this can happen within, by the time you see them next, like, you know, generally once a week. If they see them in a week, it can heal that much to uncover calculus that you leave. So when I saw my patients for this kind of work, if I had really deep pockets, I'm working as deep as I can go while they're numb, because I know if I miss something closer to the CEJ, I'm going to be able to get it after healing pretty easy. It's going to be sitting right there looking at me. So that guided my treatment for the patient.
Also, one more question. Is the trunk of the mandibular first molar smaller than the maxillary first molar?
It tends to be quite short, yes.
Okay.
It tends to be short, so that you may fall into these. Because here you see this is the CEJ, and already there's a depression starting here and leading into that furcation. So you really want to check for these on mandibular molars. I see it all the time in the students' chartings. They don't look for it, and when they're charting, and they miss it a lot on these permanent molars.
Thank you.
Oh, you're welcome. Here is another clinic slide of a patient who presented some nice enough recession that I could, you know, get a picture just to demonstrate the roots on these teeth here. And you see there's more recession on this mesial root than there is on the distal, because it's sticking out there further. It's important to note the contours of these roots. If you have to instrument a patient who has bone loss to this point in the roots, then you have to realize you're going to have these areas of depressions, longitudinal depressions on the roots. Again, here's another patient, tooth broke off, it had root canal treatment, and this is one pulp canal within the root. I'm coloring in, and here is a second one on that mesial root. There, so if you have to, again, if you have this, you would be treating each root as really as an individual tooth. And these depressions are ones that you need to negotiate with your instrument. Classic depression is one that is on the mesial aspect of the mesial root. And that's very important to know in particular. A deep depression, large, deep longitudinal depression on the mesial aspect of the mesial root of the first mandibular molar. Looks like two pulp canals here too, actually. They're just closer together. But it's characteristic of the mesial root of the first molar to have, you know, two pulp canals. It's a big root. It tends to be pinched here in the center. And so it's very, I've seen board questions with that about, you know, which root, the root of what root of which tooth root would have is most likely to have a deep mesial depression. And it's this mandibular first. So again, you got to take care of that when you're treating your patients who have gum disease and bone loss. The lingual view of this tooth, it has two cusps also, mesiolingual